going on, everyone? Hey, I'm just leaving an appointment that I just had at a place called Pain Care Boise. So I'm giving some free publicity over here. And it's kind of funny, I was talking to Vlad at our support, and I said this is like the epitome of what we talk about in chiropractic. And what's Dr. Todd doing at a pain care clinic? What a sellout. What's going on? Well, actually, what it is I just came by here for a consultation. And hi, Kaylee, how's it going? Hi, Brandy, how's it going? I came by here for a consultation so I could learn more about something for myself and also for our patients, because this is a pain management doctor that has referred some patients to me. His nurse practitioner has referred patients to me. But they do something I'm really interested in, which is PRP injections, platelet-rich plasma, and stem cell injections. So more of a preventative thing. So I currently have a very, very mild patellar tendonitis that it's more of a proactive approach. It's almost ridiculous that I'm even going in for an appointment because of it, because most anyone would just say, wait 2 weeks and it'll feel better and go away. But I know this is a tissue weakness in my body, I'm sure, and it's probably something that would benefit from like PRP. So came in, just did a consult, and I'm chatting with the nurse practitioner. And here I plugged in some audio, and she's super nice, super cool. And something we're seeing if we can do is learn more about how this works, because they also do this for disc, which is interesting how they do it. So just to teach you what I learned, if they're doing stem cell, they actually take a person's own stem cell from the crest of the ilium. They do an in-office procedure, they partially sedate you, and they take tissue out of the crest of the ilium. That's where they harvest stem cells from. Then they take blood and they spin it in a centrifuge to get the platelet-rich plasma. And then there's different tubes they put these in. Apparently that's what makes this procedure slightly different, is the tubes, and then the specificity of how they inject it into the tissue being ultrasound guided. And so this is something they've done here for several years. This is a procedure that's become popularized with Olympic athletes and whatnot in the last decade or more. And so I wanted to check it out because I look at this as a preventative thing for myself and also for our patients, because potentially, and I'm going to meet with the doctor here probably next week, but potentially, so if someone has a really bad disc, someone has a very degenerated disc, can they do stem cell and PRP and help regenerate that disc? And I know there's chiropractors that like do medical integration and they do this kind of stuff in their practice and that sort of thing. And I guess that's cool and all, but I'm more of looking for someone that has like an actual center on site. Not to say a chiropractor couldn't do that on site, but I'm looking for more of a operating room type of environment where a anesthesiologist is actually doing the procedure. Okay. Someone who has extensive training in it. And so that's who this is. This is a 25 plus year practicing anesthesiologist who's in pain management care and is doing some natural approaches, which is cool, like PRP and stem cell. So anyway, I think it's interesting. I'll share with you what I learn as I go. And it's not something I ever am interested in doing ourselves in office, because I just think that's so outside of the scope of what we do, what I'm comfortable ever getting involved in. Not to knock any chiropractors that have maybe an MD in their practice doing it. There's other things with medical integration that I think are just very expensive and costly and distractive from what we're doing as chiropractors. So in my personal opinion, I feel like it's easier to keep that separate and outside. So in case you're thinking that as I'm going through this conversation. But more than anything, I wasn't posting this to have a conversation about medical integration. I was posting this to share the fact that, let me flip this around, that I am parked in front of a place called Pain Care Boise, and I just felt like that was funny a little bit, because it's the exact opposite message that we're trying to convey in chiropractic. Because in chiropractic, in corrective care chiropractic, what are we trying to convey? We're trying to say things like, we're not just interested in making your pain go away. All right? We're not just interested in treating the symptom, but we want to dig deeper. And the good thing about platelet-rich plasma and stem cell is that it's more of a corrective and down the road surgery avoidance technique. So with that said, if you have anything to say about it, if you know anything about this, doctors, whomever's watching this, comment below, let me know. I've been reading research on this. I've been doing some studies myself in the last couple of weeks, and it got me interested enough to want to schedule an appointment and come talk to the place. And just so you know, I hate getting my blood drawn, okay? I don't like needles. I don't like needles in veins pulling blood out. And and what I talked to him about, being a chiropractor, I have some pain in my thumbs, my wrists, tricep tendonitis, patellar tendonitis, all very mild. But my thought is, if I could do something like this myself, I'd probably have them somewhat give me something, so I just really don't care if I was getting like 6 different sites worked on at one time. So Kaylee, Brandy, April, all my staff who's watching this right now, if I end up getting this done, probably be on a Wednesday afternoon, and I'll take an ice bath or something afterwards because it causes some inflammation, and then hopefully I can come in Thursday and still adjust patients and not be too sore from the procedure. But we'll see. I'll keep everyone posted. Over and out. Talk soon.